There is no denying it, recovery after an ACL surgery is hard, but it doesn't have to be. Many of the difficulties people have with rehab are often self-inflicted, or at least can be made easier with specific strategies. So in this video, I will be covering everything you need to know to promote a smooth and successful recovery after ACL surgery. And later on in the video, we will talk about a lesser known cause of muscle weakness after ACL surgery that can derail people's rehab, so stick around. Hey everybody, welcome back for another episode of Physioshow, where we answer all of your rehab-related questions. In the world of sports, there's not a more dreaded season-ending injury than an ACL tear. And while surgeons have ACL reconstructions down to a science, many overlook the challenges of recovery that follows. Athletes rehabbing after an ACL tear face some serious obstacles as they work to return not only to playing, but competing at a high level. Now, out of all the stages of the recovery process after an ACL surgery, I'd say that the early post-operative phase is the most easily managed. These days, surgical techniques have advanced to the point where ACL reconstructions can be performed with minimal trauma to the surrounding knee structures, helping to alleviate pain and swelling. Surgeons reconstruct the ACL through tiny incisions, preserving as much healthy tissue as possible. And since generally those who receive the surgery are younger and healthier, most experience less inflammation. Now, that does not mean that the early phases of rehab are without its challenges. There will be pain and swelling, and it's something you want to manage effectively early on. Because if you don't, you will be less inclined to move your knee. And you must move your knee. You don't want to be dealing with stiffness. Simple things like using compression sleeves and elevating your legs to manage swelling, using ice and taking your prescribed medications for pain management, and performing the recommended exercises to restore movement can be all you need to make the earlier phases of rehab more manageable. But if you're still having a tough time regaining motion despite exercise, or start to lose motion later on, there may be an issue of the knee itself. Check out this video where we discuss a common reason for loss of knee motion after ACL surgeries. Now, the real challenge lies in the months that follow surgery. During this time, you will need to demonstrate some serious dedication to your rehab, focusing on rebuilding strength and power of your legs. And while other knee surgeries also have challenges of regaining muscle strength, if you had an ACL reconstruction, you are probably looking to get back to playing high-impact activities, which takes a whole other level of strength. That's the real challenge. Persistent weakness, particularly of the quadriceps muscle, presents a real issue for many after ACL surgery. And a weak quadriceps is a non-starter for returning to higher impact activities, as it will significantly impact your performance and increase your risk for re-injury. Studies have indicated that even years after surgery, people continue to experience persistent weakness. This can be attributed to a number of reasons, including insufficient loading of the quadriceps muscle throughout the recovery process and lack of consistency in performing the recommended exercises. Properly loading the muscle during rehab is essential for promoting hypertrophy and strength gains. This is achieved by systematically progressing the resistance and intensity of exercises to stimulate muscle growth and improve strength, which is crucial for restoring control and stability of the knee. By subjecting the muscles to controlled resistance and progressive overload, you can stimulate the muscle fibers to adapt, not only enhancing overall muscle mass, but also improving the muscle's ability to generate force, contributing to the greater performance of the knee. And I can't stress this point enough. Adequate muscle loading is essential for preparing the body for quick and powerful movements such as running and jumping. These activities place significant demands on your body, requiring rapid, forceful contractions of the muscles to generate propulsion and absorb impact forces. Without sufficient muscle strength and endurance, your dynamic movements will be compromised, which will place stress through the knee. So remember, before you even think about running or jumping, you need to lay a strong foundation of muscle strength and endurance. This involves targeting specific muscle groups, including the quadriceps, hamstrings, calves, and glutes, through various resistance training exercises. And don't consider strength training using therabands, cuff weights, or body weight to be sufficient. That's okay in the earlier stages of strengthening after surgery, but those tools won't cut it in the later phases of rehab. You need to load the muscle, and unfortunately, many rehab clinics do not have access to sufficient equipment to do this, resulting in many athletes plateauing and not getting back to the strength they need. So if your rehab clinic does not have the proper equipment, make sure to get a gym membership so that you can have access to the necessary load needed to regain strength. Your therapist can very easily provide you with a program to follow. In addition to promoting muscle hypertrophy and strength, proper muscle loading also involves training the muscle to fire faster, a concept known as rate of force development, or RFD. RFD refers to the ability of the muscle to generate force quickly, which is essential for explosive movements like sprinting, jumping, and changing direction in sports. To improve RFD, you can incorporate plyometric exercises and speed drills into your rehab program. Plyometrics involves rapid, explosive movements that require the muscles to contract forcefully and rapidly, enhancing their ability to generate power and speed. Examples of plyometric exercise include jump squats, box jumps, and bounding drills, just to name a few. Incorporating exercises that specifically target muscle firing speed can help bridge the gap between strength training and sport-specific movements. So by focusing on muscle hypertrophy, strength, and rate of force development, you can optimize your rehab outcomes and prepare your body for the dynamic demands of sports and other high-intensity activities. Another issue people come across that is lesser known to the general public is something known as arthrogenic muscle inhibition, or AMI, which disrupts the muscle's ability to contract efficiently. Studies have shown that high-intensity NMES can effectively counteract arthrogenic muscle inhibition by providing targeted stimulation to the affected muscles, usually the quadriceps, by delivering electrical impulses directly to the muscle fibers. NMES bypasses the neural pathways that have been inhibited, promoting more controlled and forceful muscle contractions. This can help restore muscle function and prevent disuse atrophy, where the muscle loses size and strength simply due to the lack of engagement during the earliest stages of rehab. Research has demonstrated that combining high-intensity NMES with normal exercises early in the rehab process can lead to superior quadriceps strength and functional performance compared to conventional rehab alone, helping speed up the recovery process and promote a quicker return to sport. In the end, overcoming the challenges of ACL surgery and returning to sports requires more than just time. It demands significant determination and dedication to recovery. With a well-structured rehab program, access to sufficient equipment and load, and a commitment to the process, you can ensure you regain the strength and power you need to get back in the game. If you're interested in what it takes to return to run, or which ACL graft is best for returning to sport, check out these two videos. Well, thanks for joining me on another episode of Physioshow. Make sure to hit that like button and subscribe to the channel so you can learn more about your body, how it works, and what it needs to keep moving.